My name is Trevor Scott, and I specialize in hip and knee replacements and revision replacements, also known as adult reconstruction. So the most common diagnoses I treat are hip and knee arthritis, but I see a lot of relating and overlapping diagnoses. Around the hip, there are a lot of different pain generators. So I'll see patients with muscle strains, something known as trochanteric bursitis. I'll see a lot of patients who come in to see me and it ends up that they have a lower back problem. That's very common. There's a lot of crosstalk between the hip and the lumbar spine. I very much try to treat every patient individually and kind of meet them where they're at. I like to spend a lot of time with patients up front at the first visit, figure out exactly where the pain is being generated. Because a lot of times patients send to me and they think they have a hip problem, and it turns out it's a pull muscle in their back or something that's not even related to the hip. And I really like to tease that stuff out early on and then try to figure out how the patient wants to approach it. Because for most of the things we see, there's often a variety of treatment options, especially because the most common issue I'm seeing is hip and knee arthritis, and there are treatments as minimally invasive as Tylenol or as big as a surgery or sometimes a revision surgery, and you need to figure out what the patient's goals are and how they want to get there. I think that working here is really unique. When I was finishing fellowship and looking at jobs a few years ago, this was the only practice out of many that I interviewed at where the question was not how many surgeries you could do a day, which is basically what I was asked everywhere else, but what do I need to take the best care of patients and offer them the best services that I can offer. And I thought that was really unique, and I think that continues to be reflected by all the physicians here and the team. I mean, our goal to a person is to help people as much as we can, and I'm proud to work here for that reason.